Okay. Okay, hi everyone. Welcome to SRSA's August virtual webinar. I'm Julie Marshall from the Medical University of South Carolina, and I'm also on SRA's Executive Council. So on behalf of the council, thank you so much for joining us today. We have two great papers for you. The first is by Zachary Keeler, a doctoral candidate at West Virginia University, who's going to talk to us about the capitalization of metro rail access in urban housing markets. And his discussant will be Steve Deller from the University of Wisconsin-Madison. Our second paper will be presented by Devon Meadowcroft, formerly of Pennsylvania State University and now at Mississippi State, who will talk to us about the relationship between opioid-related deaths and high-risk jobs. And her discussant will be Logan from the Appalachian Regional Commission. So before we get started, I just want to go very quickly through some housekeeping logistics. We are recording this session and it will be posted on SRSA's YouTube channel as well as on srsa.org. In this webinar, you can interact with the panel by raising your hand virtually, typing in the chat, or typing in a Q&A. And this is how you raise your hand. You can click the raise your hand button and then lower that. You can also send us messages with chat. This is going to be controlled by me, and we are generally, I'm going to hold questions on each of the papers until both the presenter has finished as well as the discussant has finished, and then we will commence with Q&A. So unless there's a clarifying question, I am just going to hold those questions until each paper presentation is concluded. And we will go ahead and begin with Zachary Keeler, if you want to share your screen.
Sure, let me go ahead and do that. I think you may need to stop sharing your screen. Okay. Is it up?
I can see it.
Okay. Hello, everyone. My name is Zach Keeler. I'm a PhD candidate at West Virginia University, and today I will be presenting my paper, The Capitalization of Metro Rail Access in Urban Housing Markets. This will eventually be turned into my job market paper, so any comments and feedback would be greatly appreciated. Not letting me advance. Okay, there we go. So metro rail systems are becoming increasingly popular in many major US cities, and this is because of the benefits that they provide. So a few examples here: provides affordable and sustainable transportation, increased connectivity, reduced traffic congestion, increased economic activity, the list goes on and on. But they're also associated with some negative externalities, such as noise and crime. So one way to assess the impact of metro rail access on local communities is to see how it's capitalized into property values. So using housing data, I examined the impact of two new metro lines, specifically the Gold and Expo lines, on property values in Los Angeles. So house prices may increase if residents recognize the benefits of the line, but they may also decrease if those negative externalities outweigh those benefits. So in terms of contributions, I examined the impact of multiple new metro lines in which the capitalization effect may vary across neighborhoods. So most related research on this topic primarily contain case studies focused on one metro line in a single community. So by looking at multiple new lines across multiple neighborhoods, I provide a more complete picture of metro rail access in a region. I also provide further insight into the potential heterogeneity in the valuation of metro rail access between communities. And this is especially important in the face of COVID-19. So understanding how different populations value metro rail access can help promote infrastructure in areas in which the residents positively value it and are more likely to continue using it during and after the pandemic. And I also use more updated housing data than previous studies. So just a little background on the Metro Rail system in Los Angeles. There's a lot of people that use it. So over 9.7 million people rode it in 2014, and this figure has continued to rise. It's relatively new with the addition of the Golden Expo lines in 2003 and 2012, and there's expansions of these lines as well as other lines as well. And there's a lot of money being poured into it. So the expansions of the Golden Expo lines bring the total to around 2.8 and 2.4 billion respectively. So with so much money being spent on it, it's important to understand the value that residents place on it and how that value may differ between communities. So one of the first papers to look at this topic is McMillan and McDonald. And they find that there was a positive capitalization effect in Chicago. They also find anticipation effects. So they look at what happened after the announcement of the line and found that house prices were actually increasing before the line even opened. Another study finds that rail transit upgrades increase house prices in 5 major US cities. And relevant to the current study, Redfern 2009 looks at the red and gold lines on house prices in LA and finds no capitalization effect of access to light rail. And although he does look at the red and gold lines, the gold line that he looks at was the first wave of gold line. So I look at the later expansions of it. And these areas that got Metro Rail access in my study are completely different than the areas that he looks at. And I also use more recent data. So as I've been mentioning throughout this presentation is that there's heterogeneity in the stations area, and the characteristics of the areas surrounding the Golden Expo lines are very different from each other and also other areas that previously got Metro Rail access. So just a few examples here. Major parts of the Expo line fall under the category of very low income. This is in comparison to station areas along other lines being classified as low income. And then the Gold Line passing through Little Tokyo and Chinatown has large non-Hispanic Asian populations. So these are just 2 examples of how the income levels and demographics may result in residents valuing it differently. So the data that I use, the housing data are from DataQuick, and it covers 1995 to 2014. Information on the Gold and Metro lines come from Metro Primary Resources and Metro Developer. And this includes when construction started, when the lines opened, and the locations of the stations. So for the stations included in this analysis, they open in several different phases. So the Gold Line opened in 2 different waves, the first being from Union Station to the Sierra Madre Villa Station, and that started construction in 2000 and opened in 2003. From Union Station to the East LA Civic Center Station, that started construction in 2004 and it opened in 2009. And then the Expo line in this analysis extends from Culver City to the LATTC Ortho Institute, and that started construction in 2006 and opened in 2012. So this is a map of the current Metro Rail system. So the Gold Line is the Gold Line up there in the top right-hand corner and extends from Union Station to the Sierra Madre Villa Station. And then the second wave is from Union Station to the East LA Civic Center Station. So it covers a majority of the Gold Line to this point. The Expo line is that light blue line down there on the left and extends from the LATTC Ortho Institute to Culver City. So I use a hedonic difference in differences model with post indicating houses that were sold after the treatment was received. So to look at the potential anticipation effects, I use the start of construction, and then to look at after the line opened, I use that as the post period. Treated houses are those within certain treatment distances. So specifically a quarter mile, a half a mile, and 3/4 of a mile. And I also use a quarter-mile buffer area between the treated and control houses. This is just to make sure that there's a distinct difference between the treated and control houses. Otherwise, a control house might be literally right across the street from a treated house. I also include a set of house characteristics, bedrooms, square feet, so on and so forth. A elementary school attendance zone fixed effects, which are relatively small. a year fixed effect, and a station fixed effect. The variable of interest here is the interaction term between post and treated. So as I mentioned, I look at the start of construction to see if residents anticipated the opening as well as the actual opening. And I use 3 different models that include different data from different subgroups to examine how prices are impacted in every stage of the process. So specifically, I include transactions from sold pre-ground break of construction, as well as those sold post-ground break but still pre-open, transactions from post-ground break but still pre-open to post-open, and then all transactions in the sample. Here's some summary statistics for houses near gold stations. As you can see, there's different sub-samples there, so pre-ground break, post-ground break but still pre-open, and post-open. And you can see that the mean house price pre-ground break was around $200,000, but once construction started and after lines open, the mean house price jumped up quite a bit. And if you compare that to houses near expo stations, pre-ground break, they were relatively more expensive than houses near gold stations. And it did increase post-ground break and post-open, but not nearly as much as houses near gold stations. And you can also see that houses near expo stations are relatively, they have more bedrooms, more square feet, and are older. So here are some of the main results. This is for the houses near the gold stations. This is model 1 and model 2. Model 3 is on the next slide. And I include the different treatment distances there. And so what we're really interested in here is the interaction term here between post and treated. And you can see that in model 1, we find a positive and statistically significant estimate for those houses within a quarter mile of a station. And this is those anticipation effects. So residents are positively anticipating the opening. And once, if we look at model 2, once the stations opened, we also find positive effects of around 4 and 3%. And you can see that we find distance decaying effects here. As further treatment distances, the effect lessens or becomes statistically insignificant. We also find positive effects here in model 3, which includes all transactions in the sample, especially for those that are closest to the line. The results for houses near expo stations are a little different. So we actually find a negative anticipation effect. So house prices, once construction started, decreased around 5%. But after this, there are no further price decreases. And you can see that's also post-open in model 2, as well as in model 3. So just an overview of the main results. One thing here to take note of is that they're different between the gold and the expo lines. So for houses near the gold line stations, there's some evidence of a positive capitalization effect. So if we put those estimates into dollar values, house prices increased roughly $10,000 once construction started and approximately $15,000 after the line opened. For houses near expo line stations, there appears to be a negative anticipation effect, but no further effects after this. So because we're finding different results and we know that the areas around these stations are very different, I do several sensitivity analyses, one being quantile regression, and this is to proxy for different income levels. So specifically, I separate the sample into 4 different quantiles based on house prices in the market, using the normalized house price for all houses within 3 miles of a station. And this is just more representative of the surrounding area. And you can see the cutoff down there at the bottom. The 25th percentile is under 170, 25th to 50 is 170 to 265. From 0.5 to 0.75 is 265 to 410, and the highest quantile is above 410. So for purposes of time, I'm not going to present all of the sensitivity analysis results, but I am going to discuss them. So for houses near gold line stations, I find that higher income households are negatively valuing their proximity to the station. So it appears that the positive capitalization effect that I found in the main results is being driven by the lower or middle income residents who are more likely to use the line to travel to the downtown area for their jobs and amenities. For the houses near the expo line stations, there is a positive capitalization effect, though it's not specific to a particular income level. Another sensitivity analysis I do is I look further into the anticipation effects. So specifically, I use 3 years prior to the start of construction as the treatment year. Ideally, I would use the actual announcement year, but I was unable to find such information. But using 3 years prior to the start of construction, this should capture the effect of the announcement rather than simply the start of the construction. So just an overview of the anticipation analysis is for houses near goal line stations. I find that there is a negative capitalization effect for further treatment distances. So perhaps at this distance, homeowners did not expect to benefit from the proximity to the line, but instead to only be negatively impacted by the externalities of congestion. For houses near expo line stations, there's some evidence that residents purchasing homes after the announcement was made, they're positively valuing it. So in combination with other analyses, these results suggest that residents reacted as soon as the announcement was made and the market adjusted well in advance of the actual opening. I also use alternative controls, so specifically identified houses that were close to a line but not a station. So using a treatment distance of 1/4 mile, control houses must be further than 1/2 mile from a station, but within 25 miles of a line. So basically, the control houses must be closer to a line than a station. So this just provides further insight into the capitalization effect of living in close proximity to the physical stations. So results overview from using alternative controls for houses near goal line stations. House prices increase approximately 5 to 7% in each stage of the process. So this suggests that it is access to the line that is driving the positive capitalization. For houses near expo line stations, overall, there's a negative capitalization effect. Perhaps this is because of the negative externalities associated with stations such as crime. So in conclusion, a main takeaway here is that the results are quite different between the goal line station areas and the expo line station areas. So for houses near the goal line stations, house prices decrease after the announcement, but increase after the line open. I also find that residents purchasing the more expensive homes who have higher income levels negatively value metro access. So this suggests that it is the lower income or middle income residents who are driving the positive capitalization, most likely because they use the line to travel downtown to their jobs and amenities. On average, all houses in close proximity to the station sold for more. For houses near the expo line stations, residents appear to be anticipating the opening. So the market adjusted well in advance of the actual opening with little additional impact after the line opened. So overall, my results provide evidence that things such as income levels and other demographics result in residents valuing metro rail access differently. And this is, as I mentioned before, important in a time of COVID-19 when there's less usage. It'll be important to promote infrastructure in areas that will have a need for it and will actually use it during and after the pandemic. So in terms of next steps, I would like to update figures and tables with different distances. So a lot of the statistically significant estimates I was finding were for the closer treatment distances. So I want to update the figures and tables to kind of be reflective of that. I would also like to run quantile regression on smaller treatment distances. That goes along with the next step, number 1. I'd also like to explore anticipation effects on alternative control group and further describe the differences in the areas along the 2 lines. And that is all I have. Thank you.
All right, this is Steve Deller. I'm the discussant for the paper, and I'm going to go ahead and share my screen here. Oh, I got to double click that. And come on, start the slideshow. First of all, I really like this paper. If this paper hasn't been submitted for publication already, it's really very, very close to being there. Now, I have to preface some of my comments that as I read through this paper, I kept thinking about the Chicagoland area because I'm from the Chicagoland area and I know the rail system there. So to take some of these comments with a grain of salt because I kept thinking Chicago. One quick comment is when you describe where the train stations are located throughout Los Angeles, you may want to use some references to things that tourists may know. Because I don't know a lot of the neighborhoods that you're referencing. So I ended up having to go on to Google Maps to try to figure out where are these things located relative to things that I could relate to as someone who's not from Los Angeles. But I think the real value to this research is the idea that you're looking at these income differences, particularly the very low income areas of LA. I think that's really unique, and I think that brings an important contribution here. But again, just kind of review, does access to a train station have a greater positive or negative effects? The positive is the ease of access to the trains as an alternative means of transportation. LA is notorious for its congestion. So anything that's an alternative to being stuck in traffic is probably a positive. The negative is noise, dirt, traffic, and perception of crime. I'm not sure that there is an increase in crime, but again, that's my bias reference to Chicago. Really the idea here is that I want to be within walking distance to a train station, but I don't want to be right on top of the station. So what's that sweet spot there between access and being right on top of it? Okay, so the basic answer is it depends. And I think that's the real contribution here. Is that you can't come up with a generalization. It really has, the local context has to be taken into account. A large driver's income and prosperity and the propensity to use the train system. The positive effect is low and middle income neighborhoods and a negative effect in higher income. And that makes perfect sense. And I think that's an insight that we really need to be thinking about. Do people live, work, and shop within their immediate communities, or do they live in one place and work outside and work in another and shop in a third? Again, when I'm thinking of the traditional kind of Mill-Smooth model of a central business district, and everybody is living out in the outer area and commuting into that central business district. That has kind of changed over time. So my question is, how many people are actually using this to commute to downtown? There's references within the text that kind of say people are using it to commute to a central business district in downtown, but LA is really spread out. So you could have people that live in the central business district, but are actually commuting out to work out of the other area. So that's something that I kind of struggle with here. Okay, these results are reassuring in that subtleties of the local context matter a lot. So making broad blanket generalizations about metro train stations and whatnot is an error. You've got to be more subtle. Local context matters a lot. Okay, this is again the model that is being used here, but I've got a couple of comments within the model, and you addressed one of them with some of your sensitivity analysis. One is adjacent to the station seems to matter, but how close is close enough? You use 1/4 of a mile, and I'm thinking, you know, maybe even closer, okay? My daughter moved to Boston, and the apartment complex that she's in is right next to a train station. But the apartment complex is kind of rectangle. And she's on the far end of it away from the station. You can't hear the station in her apartment, but the people that are on the other side of the apartment complex that are next to the train station, they can hear the train station. And that's within an apartment complex. Okay, so it's 1/4 mile too much? Can we cut it down to even say a 1/10 of a mile or even less? The station is located in more commercial or residential areas. My thinking of a lot of these train stations is they tend to be in commercial hubs. The Chicagoland area, a lot of the train stations, not the subway stations, but the larger heavy rail stations are in downtowns. Okay, so they're in local city downtowns, more commercial districts than residential districts. Okay, proximity to the tracks, and not the station, but the tracks, because it's the noise that is bothersome. So it's not necessarily close to the station, but it's close to the tracks. The frequency of the trains, and again, this is where I'm not quite clear. Are we talking about light rail here, like a subway system? Or are we talking that's fairly frequent, that's coming in and out of the stations on a fairly frequent basis? Are we talking about something that's more of a heavy rail, a longer distance commuter train that is less frequent? Okay, so that was a point of clarification that I wasn't quite clear on. The school fixed effects. I don't think that's enough to capture the neighborhood effects. And when you kind of describe that you didn't really get very good results for that, I'm not really surprised, because these school district or these attendance areas can be kind of large, and they're not really capturing some of those local amenities that are oftentimes capitalized into property values. So I'm not surprised you didn't get it. I think you need to think about another way of capturing those local neighborhood effects. And that can be, I mean, anything from, like, you know, proximity to a park, proximity to a bunch of really good restaurants and coffee shops, things like that. Okay, so again, something to think about here. I'm not surprised that your school attendance zones didn't really work. Okay, I really like the quantiles. It really gets at it depends angle. And when you stop and think about it, yeah, it makes a whole lot of sense that lower and middle income folks are more likely to use public transportation than higher income folks. And folks in these different income categories are going to react to this differently. I'm a little worried about the spatial proximity of individual housing units that are sold over a period of time. Okay, housing prices are largely determined by comparable house sales, and spatial proximity matters a lot. How close are these homes to each other as they have sold? Because there will be a spatial spillover effect, and that spatial spillover effect appears to be missing a little bit. Okay, so a couple of ideas thinking forward. I'm not suggesting that you do these for the current paper. I think the current paper is pretty strong and could move forward. I think as you continue to analyze these train stations for future research, these are some things to think about. Maybe use something like a geographically weighted regression approach to say that this underlying relationship varies by space. Okay, I think that oh, his name just slipped out of my mind. Gordon Mulligan has been doing some work, had done some work using geographically weighted regression and housing prices. It might be something to think about for a second paper or even a third paper. Any thoughts on looking at commercial real estate, such as retail and restaurants? When the high-speed rail stuff was announced out of the Obama administration, there was a lot of interest on the impact of these high-speed rail stations. And one of the things that came out is the growth in retail aimed at these commuters. So another angle might be is that as you see these stations pop up, do you start to see restaurants and coffee shops and things like that that are starting to pop up that are aimed at servicing those commuters? It might be a second way of looking at it. And what I like about this is that this is a current investment, and there's new investments moving forward related to the LA station. So this is a great case study that could continue to do a line of work. And I'm going to stop at that. I really like the paper. A couple of clarifications points. I know that you've got some limitations on how long a paper can be for submission, but you know, the little things like people that aren't as familiar with LA, you know, kind of say, you know, this is close to the movie theaters or the movie studios, things like that. But I really liked it. It's very well written paper and very easy to read and very easy to follow. The volume of results can get a little tedious. So that's why I'm kind of suggesting, you know, don't do new analysis for this paper, but kind of future forward looking. So thank you.
Yeah, well, thank you for your comments. I really appreciate them. They were really insightful. If I have the opportunity to respond to a few of them real quick, I would like to do that. So I think it's really interesting that, you know, you mentioned possibly even using a closer treatment distance. The only thing with that is I would have to make sure that there would be enough treated houses that close to a station, especially, you know, a single family residence in Los Angeles. But I do think that, you know, people right on top of the stations, there would probably be, you know, a really big effect for those houses. I also think, you know, your idea of using like geographically weighted regression is interesting, especially because we do know that the areas are very different. So, you know, kind of looking at a technique that might smooth over space, something like that might be interesting. And also you mentioned possibly looking at maybe in a future project, commercial places and stuff like that. That might be interesting, definitely. I think it might be worth exploring in the future. Currently, I only have, single family residence housing data. But if, the data become available, that would definitely be something that would be interesting.
Because you might be able to look at commercial rents, because I would imagine that a lot of the commercial properties rented, and that rent data is probably out there somewhere, but you have to dig for it. The other one that I had, and I thought I put it on my slides, is to maybe look at a subsample of houses that have sold before and after. So you can actually say this house had a sale before and had a sale after, and look at the and track the individual houses. It'd be a much smaller sample, but it might be a little, unless there's been some major changes to that particular house, it's a cleaner sample to look at.
Right. Yeah, definitely like a repeat sales analysis.
Yeah. Yeah.
So in Los Angeles, there's actually a Proposition 13, which says that basically houses are only reassessed when they're sold. So for tax purposes, a lot of people don't move as much, which kind of results in a sticky housing market. So there aren't as many repeat sales. So like you mentioned, I may have a problem finding enough houses that were sold at least twice. But if there are enough, then that would definitely be something that would be interesting.
Oh, the unintended consequences of Proposition 13.
Yeah.
Yeah. What a mess.
Right.
Good job.
Thank you for your comments.
Thank you, Zach and Steve. We have one question, it looks like. Scott Langford, I'm going to unmute you.
Hello, can y'all hear me?
Yes.
Okay, perfect. So this is wonderful paper. I had sort of two, I suppose, questions / comments, perhaps for future, future work. The one, so to give you a little context, I'm at UNC Chapel Hill, and we're in the Triangle area, and we had a planned metro station, and our friends to the west at Duke University had other ideas, and so that got scrapped. But that gave me the ideas, how frequently do these projects get planned and then something comes up and they're denied, and so that might offer an opportunity for another counterfactual in terms of anticipatory effects. And I'm also curious if you might be able, sort of, I suppose it's more technical, to look at like something like a driving distance or a walking distance versus a physical distance to control for density in an area, like a residential area versus a more commercial area. So I suppose those are more sort of comments and for future ideas, but I just wanted to throw those out there.
Okay, yeah, thank you. So in regards to your first comment, there was actually a paper published recently by Wagner, and I think it was published in Regional Science and Urban Economics, that looked at like a proposed light rail station that was used as a counterfactual. So that might be, I think, what you're kind of referring to with your first comment. So I'm not exactly sure how the whole, the planning process works. But I think, a proposed light rail station that eventually did not come into effect, that's definitely something that's interesting. And also with your second comment, I actually started out using a network-based distance, like you suggested, using a local road network. Unfortunately, with so many transactions in the Los Angeles area, I did not have enough computing power, and it just it kept shutting down on me. So
that makes sense.
I tried it, but I think with as many transactions as I have, that it just didn't really work.
No, that makes total sense. I'm running into a similar type thing. So, yeah. But thought that might be kind of an interesting way.
Yeah. Thank you.
Zachary, with this, there's so many variations and different ways that you could look at this particular case study that you could make a career out of this, or you could get so sick of it you don't want to ever touch it again.
Right.
All right, thank you, everyone. If you do think of any questions here in the next half an hour or so, please go ahead and type those in the chat box, and we'll let Zach address those here at the end of our session. So next up, we have Devon Meadowcroft. Devon, if you want to share your screen, and then her discussant will be Logan Thomas.
Devon, you're muted.
Okay, good now? Okay, sorry about that. So what I was saying when I was muted was that the title of this presentation is the relationship between opioid-related deaths and high-risk jobs. I worked on this study with Stefan Getz while I was a postdoc at the Northeast Regional Center for Rural Development at Penn State. So,
Okay, and I think Zach was able to, there you go.
Okay, so just before I get into the study, I would like to acknowledge and thank the funding source for this project, which also supports the NERCRD Center at Penn State. So why are some places in the US experiencing higher rates of opioid misuse, higher rates of opioid-related deaths in comparison to others? So there are several theories that exist in the literature and that people have about why it seems that some parts of the US are particularly affected when it comes to opioids in comparison to others. So some of the theories that exist I listed here. Some think that poor economic conditions leads to higher rates of opioid misuse, places with high rates of unemployment, high rates of poverty, high rates of income inequality, that can kind of lead to high rates of opioid misuse and issues related to that. Some people think that more rural areas in the United States, they're affected more in terms of opioids. Rural areas tend to have older populations who tend to have more opioid prescriptions given to them, and also people in rural areas tend to have wider social networks, which eases the access to opioid medications. And some people think that the existence of state and local regulations has an effect on rates of opioid misuse. So there have been several studies on how state prescription drug monitoring programs impact opioid misuse. And for those of you who are not familiar with those programs, every state has, except for Missouri, has an electronic state database that collects information on opioid prescriptions in hopes of preventing doctor shopping, overprescribing by physicians, and the diversion of these medications. So every state has a different program depending on the state's regulations. So researchers have looked at how those state differences impact rates of opioid-related deaths and misuse. Another local regulation that has been examined and that could come into play on why some areas have more issues with opioids is that some places have really strong Good Samaritan laws. So if you see someone experiencing an opioid overdose, you can call that in to the police, to the emergency medical services, and you will not face any legal repercussions yourself for calling in that overdose. And then lastly, some researchers have looked at how demographic makeups of populations, how that is correlated and related to opioid misuse. So the last one that I listed is the jobs of the population. That is the theory that is explored in this study. So basically seeing if people who work in a high risk injury, and by that I mean an injury that you're more prone to experiencing an injury or getting or having work-related pain, how that then translates to opioid misuse and then an opioid-related death. So how do we get from having a high-risk job to opioid misuse? So let's say someone works in a high-risk injury where they're more prone to an accident, where they're then prescribed, an opioid medication. They're given that medication by a physician. And then we know that the longer you take an opioid prescription, the higher your chances are of developing an opioid misuse issue, which then could turn into an opioid-related death. So we know from past literature that opioids are commonly prescribed for these work-related injuries. In the first study I mentioned, over half of the sample of the Washington state workers were prescribed an opioid at their first doctor visit for work-related back pain. So at the first doctor visit, they were prescribed an opioid. The second study, pretty recent, that states that almost 1/3 of injured workers in Tennessee were given an opioid medication within 6 months of their injury. And then lastly, it kind of goes into the persistence of people filling their opioid prescription for work-related pain. In Maryland, they found that about 30% of the sample who filed for workers' compensation filled an opioid prescription over 90 days past their injury. So people are getting prescribed opioids for their work-related pain and injuries. And as that last study shows, they are continuing to fill these opioid prescriptions and use them persistently. And there's also been several studies that have looked at this issue, the relationship between having a high-risk job and opioid misuse. So first, between 2003 and 2013, one study found that the number of industrial workers, the number that were given an opioid prescription, almost doubled. The next study found that being in a physically demanding job was positively associated with opioid misuse in a sample of workers across the country. And that relationship was actually stronger for female workers as opposed to male workers. Going into specific industries, the last two studies on this slide go into that. So workers in construction and mining and extraction were found to use prescription opioids in a non-medical capacity in the past month in comparison to workers in other industries. And the last study is specific to Massachusetts, and they found that, again, workers who worked in construction or in the fishing industries had higher rates of opioid-related deaths in comparison to workers in other industries across the state. So the main objective of the study, to boil it down, is that it explores the theory that counties with a higher percentage of their workforce and high-risk injuries are more likely to experience opioid-related deaths in their communities. So how do we define high-risk jobs in the study? So I read a bunch of literature and I kind of found a good definition that I liked and I thought was appropriate. So this one book chapter mentioned that there are some industries out there that have a higher risk of work-related injuries due to the workplace factors, and also the people who tend to work in such industries. People who work in these industries tend to be younger, less educated persons who are at a higher risk of getting injured on the job. So the 2-digit NACE codes I used to define high-risk injuries are listed on the slide. So things like agriculture, mining, construction, manufacturing, going into wholesale and retail trade, transportation and warehousing. Those people tend to work really long hours, sitting, driving all day. Their overexertion is an issue for people in transportation. And then healthcare and social assistance. So nurses, doctors, they do a lot of lifting, a lot of hours on their feet, and they tend to have higher rates of work-related injuries and pain. So this is for 2017, a map of the US, and it shows how high-risk jobs are dispersed across the country at the county level. So the red counties are counties with higher percentages of their workforce in a higher risk job. And then blue counties have a low percentage of their workforce in a high risk job. So immediately when I made this map, what jumped out to me was how significant the Rust Belt stood out. States like Ohio, Pennsylvania, a little bit of Michigan, Indiana. So higher percentages of their workforce are in these high risk jobs in 2017. But when I looked at the data and looked at the county with the highest percentage of their workers in high-risk jobs, that county is actually in Nevada, Story County. It's a little county right outside of Reno, right by Lake Tahoe, and they are famous for being the hotspot for gold and silver mining back in the 1800s, and they have about 84% of their workers in a job that is considered high risk in this study. So the data, the outcome variables, I do use opioid-related deaths, age-adjusted rates. So I do two types of opioid-related deaths, prescription opioid and then illicit opioid. So the illicit opioid or deaths related to opium, heroin, and then synthetics. And the data comes from the CDC restricted access mortality files at the county level. Explanatory variables, that high risk jobs variable that I've been talking about comes from the BEA, employment by NACE industry tables. I also use population, median household income, percentage male, percentage white as our demographic controls. They come from the Census American Community Survey. And then I include a prescription drug monitoring program dummy variable to signify if the county was in a state with an operational program for that year. So methodology, I do two-way fixed effects models from 2010 to 2017. Why this time period? So this is post-Great Recession where there were significant changes in labor demand and what kind of jobs companies were looking for. There was kind of a shift, a polarization between really high skilled and really low skilled jobs in the labor market. So I wanted to kind of capture how jobs are changing after the Great Recession by using this time period. Also, this time period corresponds to when we really started to observe the really negative effects of the modern opioid epidemic in the United States. So as I mentioned previously, all analysis is done at the county level for the entire US. I did end up having to drop 60 counties that didn't have any employment information from the BEA. These were mostly the small cities in Virginia and then one or two counties in Alaska. And in the models, I include high-risk jobs as a total percentage and then as individual industries in the models. And just to note that all the explanatory variables are lagged by 1 year. So here's my first set of results. This is when I included high-risk jobs as a total percentage, and the outcome variable here is prescription opioid-related deaths. So the main finding here is that I do find a slight positive correlation between high-risk jobs and prescription opioid-related deaths, both in the models with and without the demographic controls. So this lends some support to that working hypothesis that counties with a higher percentage of their workforce in high-risk jobs then experience more prescription opioid-related deaths. However, when I include the high-risk industries as their individual percentages, I don't get a lot of results that really support that hypothesis. I end up getting a lot of negative coefficients. That retail trade really stood out to me. That shows a negative association between counties with a percentage of their workforce in that industry and prescription opioid-related deaths, which I'm going to talk about and dig into a little bit more later in the presentation. So this is for illicit opioid-related deaths as the outcome variable when high-risk jobs are included as a total percentage. Similar results to the prescription opioid-related outcome variable. However, that high-risk jobs variable loses significance when the demographic controls are added. But in the first model, when it's included by itself, it does show a positive correlation between high-risk jobs and then more illicit opioid-related deaths. When I include the high-risk jobs as individual industries, I get a lot more interesting results. That construction shows a positive correlation, which goes back to the literature, what previous studies have found. However, that relationship goes away when the demographic controls are added. And then the two industries at the bottom, transportation, healthcare assistance, show positive relationships with illicit opioid-related deaths in both the models. So to kind of dig into more of the discussion of these results, so for the models with the prescription opioid deaths as the outcome variable, when the high-risk jobs are grouped together, we do see a positive association between prescription opioid-related deaths and percentage of the workforce in high-risk jobs. But when they're included in as their individual industry, we don't see any significantly positive associations with prescription opioid deaths. We see a positive but not significant relationship between deaths and percentage of the workforce in mining and wholesale trade. The mining goes back to what previous literature has found, but we do see that significant and negative relationship between deaths and percentage of workers in retail trade, which I mentioned earlier. And these are some maps. So on the bottom, this is for 2017, the end of our sample period, is the percentage, the bottom map is the prescription opioid death rate across counties in the US. The blank counties are the counties with no prescription opioid related deaths in them. And then the top map is the percentage of workers in retail trade. So the bottom map that shows the prescription opioid related deaths, you can see it's pretty much concentrated in Appalachia, a little bit in the West Coast, in states like Utah and Nevada, but the percentage of workers in the retail trade, it's pretty much dispersed across the United States, and states with really high percentages like Maine, Florida, really don't have a lot of prescription opioid deaths in them, which could be a reason why we see that negative result. Moving to the results where the illicit opioid deaths was the outcome variable, we see that the percentage of high-risk jobs is positively and significantly related to illicit opioid-related deaths when the control variables are not included. So we see, when we go to the individual industries, we see the positive and significant association between illicit and opioid deaths and percentage of workers in the following industries: construction, transportation, warehousing, healthcare, and social assistance. But we see that negative association between deaths and workers in those industries for the ag industry, for mining, and then for retail trade, similar to what we saw with the prescription opioid models. So the bottom map here shows illicit opioid death rates in 2017, pretty concentrated on the East Coast, states like Ohio, West Virginia, Pennsylvania, moving up to Massachusetts, Connecticut. And then the top map shows the percentage of workers in transportation and warehousing across the US. And remember, these two had a positive association between them that was significant. So most transportation and warehousing workers are concentrated in the cities, which is where we see a lot of illicit opioid related deaths. However, there are some spots in states that I would consider rural that have high values for both, states like North Dakota, Montana, Wyoming, and that could be contributing to the positive association between the two. And then this map on the bottom is the same, that is the illicit opioid related deaths, and the top map is the percentage of workers in healthcare and social assistance. And again, this had a positive relationship between the two. So the East Coast definitely stands out as having high rates for both. Also, Florida tends to have higher rates of workers in healthcare and then illicit opioid related deaths. So in conclusion, I would say the study shows varied results on whether a county's number of workers in high-risk jobs is related to higher levels of opioid-related deaths. I still think that percentage of workers in retail trade, that result is pretty interesting, and how it was negatively and significantly associated with both prescription opioid and illicit opioid-related deaths in all the models. There was one study that looked at the specific work-related fatalities and injuries in this wholesale and retail trade sector, and they found that most injuries in this sector were caused by overexertion. So perhaps those injuries were not severe enough to require pain medication in the form of opioids, which could be why we see that negative association. Perhaps these industries aren't having severe enough injuries and pain to require an opioid. So in conclusion, I think further analysis should be done to explore the geographical differences between the jobs that people have and how that translates to opioid misuse, if it does at all, and how interventions like patient education and prescribing guidelines could be tailored to these high-risk injuries in hopes of reducing misuse for those workers and leading to fewer negative opioid-related outcomes. So those are my references. And then in conclusion, thank you for listening to me talk, and thank you for Julie for setting this all up, and for Kristen at NERCRD for doing all the technical assistance for today. So that's all I had.
Thank you, Devon. Logan, if you want to share your screen.
Sure. All right, how's that look, everybody? Good. Okay, cool. Thanks so much, Devon and Julie, for the opportunity to get a preview of this really interesting research. This is something that's particularly relevant for ARC and for the Appalachian region due to, a couple of things, most notably that we have a higher percentage of our workforce in these high-risk injuries, or in these high-risk industries typically, and then also typically we've been disproportionately impacted by the opioid epidemic. So I think in the most recent data that I have available in 2018, the opioid-related overdose rate in the region was 46% higher, and I think for all drugs it was the difference was 48% than the rest of the country. So these are things that we're really interested in at ARC. So thank you for taking a stab at exploring this in greater depth. I think you do a really good job laying out the issue and the potential pathway, how a person goes from getting an injury and then getting an opioid prescription, then opioid misuse, and then potential overdose. I think you do a really good job there. Then also lots of really relevant literature tying these high-risk industries to a number of opioid-related outcomes, and including not just mortality, but then also just having higher prescription rates and then higher opioid misuse. So I think you do a really good job there. In terms of the model that you use, I think, I know you're at the early stages here, but just incorporating some of the things from that, I think slide 4 from your presentation, just in terms of some of the past research, just incorporating some of those additional control variables. And I threw some ideas out here that kind of maybe speak to kind of the economic conditions of an area, and then also maybe instead of population, it might be worth exploring just kind of rural status and tiering them based on whether it's urbanicity codes, RUCA codes. I'm sure you could do some exploring there. And then also, I think it would be important to include kind of the opioid prescription rates per population. So I think CDC doesn't have that available at the county level. Then also from your work with Stefan, I'm sure you're familiar with social capital. And so that's always something that we've been interested in. I know Julie and I have explored this when she was at ARC as well, just kind of how that ties into this issue. I think there might be something there. Additionally, I think lagging the independent variables makes sense here, but maybe playing around with what the appropriate lag is it very well might be a year, but maybe exploring something maybe a little longer is worth the effort. I pulled this from CDC's website, so you have from the most kind of direct impact of someone getting injured on the job and filing a workers' comp claim, that you still see this huge gap in terms of when they actually get hurt, and then when they file the claim. Then of course you still have to get the prescription filled, and then start using it, and then start misusing it, and then having unfortunately the overdose event. So I think that would be something worth exploring, or at least tinkering with. And I think kind of in a similar vein, we're probably all familiar with Casey Deaton's work with diseases of despair, and just kind of looking at some long run economic factors, so maybe not the unemployment rate that year, or maybe not, speaking of the high risk industries, instead of, the percentage of total employment in that year, maybe have, how it's changed over time. Maybe that would be something that could impact us. So I think that's particularly, that might be interesting. And also, this didn't hit me until your presentation, but I think that you might also have an issue from you're including data from 2010 to 2017. And so, as you noted, we've seen this huge spike in overdose rates over that time. So you might be kind of, comparing 2010 overdose rates to 2017 overdose rates. You might just be looking at two very different things there. So it might be worth exploring, maybe if it's worth just a smaller set of years. I know more data is better, more observations better than smaller, but maybe it's worth looking at an individual year, or maybe just a couple years there. Just a thought. But I think what you really might be able to add here is kind of exploring more kind of the geographic variation in the relationship. I think based on the literature that you've cited and literature I've seen elsewhere, that we can kind of accept that these high risk industries do lead to whether it's opioid overdose, higher prescriptions, higher misuse, but then kind of exploring the variation there at the geographic level, at the county level, I think would be really interesting. And for better or for worse, at ARC, my mind always goes to kind of coal mining and employment. So I'm just wondering, like, what is it about maybe these high risk industries in West Virginia that are so different from Wyoming? Why is the relationship then so different? So I think whether it's state level regressions or controls, a lot more about the modeling here than I do. So I think just playing around with that idea, kind of trying to drill down into the geographic variability here, I think would be really interesting. And then one last thing, I think maybe taking a step back and maybe looking at that first chain, that first link in that chain, in terms of, instead of looking at overdose mortality to start off, maybe instead looking at just kind of, are you more likely to then, are these high risk industries associated with higher opioid prescription rates? And then maybe you can prove that first chain of that potential pathway that you lay out, and then from that you can build into the overdose. But I think, again, this is really interesting work. I think you do a really good job kind of laying out the issue and the potential pathway, and I think kind of drilling down into the different ways you can look at the geographic variation in this relationship, I think would be particularly fruitful for us. So thanks again for letting me take a look and for commenting here.
Thank you. Thank you for all your suggestions.
Devon, we have one question for you, and that is whether you explored whether a spatial model might be a more appropriate specification.
I have not, but I'm thinking it might be, especially just looking at the maps and seeing how clustered some of my variables are. Maybe just starting off with a basic Moran's eye and then kind of going from there. If I see any spatial relationships, I think that would be a good next step, since, like I said, most of, if not all, my variables have some kind of spatial pattern to them.
Great. Well, thank you all. I don't see any other questions in the chat or the Q&A. Certainly feel free to reach out to either Devon or Zachary if you do have any questions or suggestions as you leave today. But I do want to mention that the SRSA Council is working on planning future sessions, one each month through the remainder of the year. I believe we have September, October, and November. We have hosts. But if you would like to present or host or moderate or participate in an active way, please reach out to John Sporing at execdirector@srsa.org, and he will be more than happy to have you present or participate another way. And with that, I appreciate everyone showing up today. Thank you for all of our presenters and our discussants. You made my job very easy, and I appreciate that. So it was good to see everyone. Thanks so much for coming, and we'll see you soon.